Imagine this. You've finally found a medication that helps you shed those extra pounds, manage your diabetes, or even reduce your risk of heart disease. But what if it comes with an unexpected and persistent side effect that makes you sound like you've got a cold all the time? That's the surprising twist emerging from recent research on drugs like Ozempic and Wegovy. A groundbreaking study published in JAMA Otolaryngology has uncovered a potential new side effect of GLP-1 medications, a chronic cough. These drugs, which mimic the hormone glucagon-like peptide-1, are widely used to boost insulin production, slow digestion, and regulate appetite, making them popular for weight management and diabetes control. But here's where it gets controversial. Researchers analyzed medical records of over 2 million patients and found that those on GLP-1 medications had up to a 29% higher risk of developing a chronic cough within the first 5 years of treatment. And this is the part most people miss. Even after excluding patients with pre-existing gastroesophageal reflux disease, GERD, the link between GLP-1 use and chronic cough remains significant. Now let's break this down. A chronic cough isn't just a minor annoyance. It's defined as a cough lasting 8 weeks or longer, and it can seriously impact your quality of life. The study also found that GLP-1 users were more likely to be diagnosed with GERD, which can trigger a dry cough. But the question remains, is the cough directly caused by the medication, or is it a symptom of something else? Researchers admit more studies are needed to confirm a definitive link and understand the underlying biology. This discovery comes at a time when scientists are exploring GLP-1 drugs for uses beyond weight loss and diabetes. For instance, Wegovy was recently approved to reduce cardiovascular risk in overweight adults, and Zepbound is now used to treat obstructive sleep apnea. Researchers are even investigating whether these drugs could help with liver and kidney disease, curb alcohol and nicotine cravings, or slow cognitive decline. But here's the kicker. While some studies have explored their potential in protecting against neurodegenerative diseases like Alzheimer's, a major setback occurred this week. 2 large trials by Novo Nordisk found that an oral version of semaglutide, the active ingredient in Ozempic and Wegovy, failed to delay Alzheimer's progression in over 3,800 adults with mild cognitive impairment or early dementia. Dr. Jonathan Razzulli, a neurosurgeon at Northwell's Staten Island University Hospital, wasn't surprised by the results. He explained that by the time participants joined the trial, their neurons may have been too damaged for biomarker improvements to restore cognitive function. Effective therapy likely needs to begin before symptom onset or very early in the disease, he noted. Despite this setback, the door isn't completely closed on GLP-1s and their potential in treating neurodegenerative diseases. Dr. Maria C. Carrillo of the Alzheimer's Association emphasized that these results will help refine our understanding of how these drugs work, even if this particular trial didn't yield the desired outcome. So what does this mean for you? If you're taking a GLP-1 medication, should you be worried about developing a chronic cough? And if you're considering these drugs for weight loss or other benefits, how do you weigh the risks against the rewards? Here's a thought-provoking question to ponder. As we continue to uncover new uses and side effects of these medications, are we fully prepared to handle the complexities they bring? Let us know your thoughts in the comments. Do you think the benefits of GLP-1 drugs outweigh the potential risks? Or is there cause for caution?